Hey guys, it's me, Jack Barnell. I'm from the Social Yet Distance podcast. And you know that we take a lot of pride in standing up for the people that we serve. As a member of the Americans for Safe Access, and through my partnership with BLOOM Hemp, we've joined Americans for Safe Access and other patient advocacy groups in signing on to a joint letter to Congress. We're calling on them to restore critical protections for medical cannabis patients and the providers. These things are covered in the Department of Justice budget. And you know what? Making these activism calls and actions have made a difference. The White House has now included language to protect state legal medical cannabis programs from federal interference. And that's a major step forward. It's a win for patients, providers, and everyone who believes in a science-based, compassionate care situation. But let's be clear, this fight is not over. We've joined this effort because our patients deserve protection, because nurses should be able to care for their patients without fear. These Department of Justice budget decisions, they don't really exist in a vacuum. They impact real people. They affect access, safety, and the nurse's ability to provide evidence-informed cannabis care. Now, here's what's really at stake. The Rohrabacher-Farr Amendment was added back in, and that's the provision, you may remember, that blocks federal funds from being used to interfere with state medical cannabis laws. Buried in that same bill is this very serious threat. There is a provision that allows the DOJ to enforce 21 USC 860. That's a law, and it means that there are double penalties for any cannabis-related activity near schools, playgrounds, youth centers, and other community spaces, even if those activities are completely legal under state law. That's dangerous. That's unacceptable. Raids and shutdowns and harsh penalties, they're not abstract possibilities. They're very real threats to the businesses, to the providers, and the countless patients that rely on these services. And it doesn't stop there. The bill also tries to block efforts to reschedule marijuana, to stop the federal agencies from reevaluating cannabis policy based on current science and public health data. That's not a good thing. This kind of policy doesn't serve the patients, and it doesn't serve nurses, and it certainly does not serve anything in the interest of justice. So here's what we need from you. Stay alert. Follow us, follow our partners like the Americans for Safe Access. Know what's going on, what's happening, and be ready, because we may call on you soon to speak out, to raise your voice, to push the Senate to do better and to do what we ask. We are going to keep standing strong, and we're going to do that for medical cannabis access and for the patients and nurses who deserve better from our government. Thank you for being here and a part of this fight. Now, I do want to take a couple of moments to talk more about an important step forward for medical cannabis patients and the providers, and why your support still is extremely important and matters. There's a win here. We celebrate progress. We recently joined the Americans for Safe Access and other advocates in urging Congress to restore the key protections for medical cannabis. Our collective voice has been working, and we want to continue the strength of that voice. The fight's not over. We're going to try to restore some protections, but the bills still include serious threats, including double penalties and some of the things that we mentioned earlier, even when all of the state laws are followed. This will put providers and businesses at risk. They will be at the risk of raids or shutdowns, which would harm the patients who depend on those services and products. Another section will block the federal efforts to reschedule, as I mentioned earlier. That's going to stop progress in cannabis policy and science. So what's at stake is real policy. It's about real patients, real nurses. We can't let fear of outdated laws or the outdated laws limit our access or our care. Here's how you can help. We want you to stay informed. We want you to follow the Americans for Safe Access. Be ready to raise your voice. Like I said, we may need your support soon to help the Senate to urge the Senate to fix these harmful provisions. In closing, we are committed to protecting medical cannabis access and supporting those on the front lines of care. And we thank you for standing with us. Included in the description, I've put all links for more information from Holistic Caring, BLOOM Hemp, The Green Nurse on Substack. Join us for education and to purchase BLOOM Hemp products at the best available pricing. Treatment planning is available as well as ongoing education. Most certainly need you to visit the Americans for Safe Access, sign any letters or petitions that are necessary, and you'll get daily updates on the laws and regulations and the changes in our government. The powers that be are running it now, and we need to remember that that's us.